Hello and welcome to AI Amplified, Healthcare AI Discussions with Dr. Heather Bassett. AI is here, it's real, and it's making a major impact. Dr. Heather Bassett is Chief Medical Officer at Exelis and is at the forefront of innovation, cutting through the noise with other industry leaders who are making a real impact in the world of healthcare AI. AI Amplified is brought to you by Exelis, an AI-driven healthcare technology company transforming the payer-provider dynamic. Let's give a warm welcome to healthcare industry champion and our host, Dr. Heather Bassett.
Welcome, everyone, to AI Amplified. On today's podcast, I'd like to welcome Ben Scharfe. Ben Scharfe is an Executive Vice President of AI Initiatives at Altera Digital Health. He is a healthcare technology leader with over a decade of experience driving growth and innovation. Ben's career spans financial leadership, operational management, and executive leadership of Altera's TouchWorks EHR system, serving over 30,000 providers. Currently, he spearheads Altera's AI initiatives across 10 business units, forging key partnerships, expanding internal AI utilization, and piloting client-focused AI healthcare applications. Prior to leading TouchWorks EHR, Ben spent 5 years at Amazing Charts, a Harris healthcare company that offers EHR, practice management, billing, population health, and additional solutions and services to independent medical practices, most recently serving as Executive Vice President. Before Amazing Charts, Ben also served as a controller at Harris Computer, the parent company of Altera Digital Health and Amazing Charts. Ben is CPA certified and earned his bachelor's degree in accounting at the University of Ottawa. He resides in the Kansas City area with his wife and 2 kids. Ben, welcome to AI Amplified.
Thank you so much, Dr. Bassett. I'm truly honored to be here.
Yeah, I believe actually you're our second Canadian to be on the show. So glad we're representing Canada on the show.
I'll do my best to represent.
Yeah. And I do have to ask, because I would say, have had a unique path for overseeing AI, initiatives at Altera. A lot of time, and I'll, some might say mine is a little atypical as well. But starting off, as a CPA and a controller, and looks like you wore several hats while you were at Harris. And then moved into this AI leadership position. Can you kind of walk a little bit through that? Because I find it fascinating how people kind of end up at the role they're in, particularly in the AI sector.
Absolutely. I think over the course of my career, I've had a couple of points along the way where, I've sort of questioned myself and had a couple of people kind of, point to me and say, how did you, end up here? And certainly I think the AI leadership position is the most eyebrow raising step in that path. But I think, really my career, spanned thus far, kind of understanding finances from a CPA perspective, lots of audit, tax, and sort of almost akin to like a consulting type role where, you move from client to client, and there's a lot of just a frenetic pace of learning. And then that really continued through my career as I became a controller. It was the first, ambulatory EHR and practice management business that Harris had acquired. And then very quickly, we went on to do a number of additional acquisitions. And through that journey, I moved into business operations and client support, then sales and marketing, and then executive leadership over a portfolio of practice management and healthcare, and electronic health record systems. And during that time, we did something like a dozen acquisitions. And so there was always a new business to learn. There was always new clients to engage with, new technologies to learn. And so it was really this constant pace of learning through my career. That's really been this common through line, this thread, being adaptable. And then when we acquired the hospital and large physician practice businesses of Allscripts, and that's what became Altera. So when I came to lead the TouchWorks business, I would say that was really going into the deep end, enterprise EHR with very large health systems in various settings. It was incredibly difficult, incredibly complex, and demanded a rapid cadence of learning. And so I think as we started to see the emergence of language models and this new sort of iteration of artificial intelligence that really sort of blew up. I had already been, I'd spent my whole life, my whole professional life really learning at this very sort of chaotic and frantic pace of just continuously learning, doing something new, every few months, really learning a new business, learning a new perspective. And so I think that's what sort of positioned me well for this new role and for, this emergence. And that's the thing that I encourage other leaders to really try to cultivate individually and in their teams, is just this real joy and love for this continuous learning journey. I think that's the most important thing to sort of cultivate as a leader in this new era, because the pace of change and disruption is only accelerating. And so that first principle is just being adaptable and sort of continuously learning, adjusting, and never, I don't think there will be a comfort zone to reside in.
No, I appreciate that. It's interestingly that's to some degree how I came into the AI space. I've always been a bit of a computer tech nerd at heart, and then the clinical piece from being a physician. But when we hired our first data scientist back in, I think, 2015, the poor guy just sat next to him and tried to be a sponge. And then the next thing I know, I'm like leading our AI initiatives. And it's a lot of fun to work with people, where you're just learning new things and they're excited to learn new things. And I also appreciate that you have kind of different perspectives, because if you think about solving problems in healthcare, the more perspectives you have, around driving workflow, or, because it's not just building AI, you've got to think about the bigger picture. But tell me a little bit about Altera. I mean, obviously there's multiple EHRs out there, and kind of, so what's unique about Altera, either, as a larger company, but then even from kind of, how you think about AI?
Yeah. So first, I'll just make one comment with respect to, what I think partnering with really smart people is just such a joy, and, finding people that you can really learn from. And just a funny anecdote on that, we hired a really brilliant guy, Dr. Taylor, who's, one of our, I'd say, most innovative AI forward thinkers, background in internal medicine, much like yourself as well. And I remember when we first hired him, I tried to kind of leave him alone and let him really, do his work. And then one day I realized, hey, I should try to I should spend time with this guy every week and make him teach me stuff. And that was one of the best decisions I ever made, was to just try to be a sponge and just, get on his calendar every week and learn from him. So I highly recommend that, those really, smart, data geeks, especially, spend time with them, and just, you can learn so much from people like that. And so to the question of, what makes Altera different? Yeah, so we do have a portfolio of different, solutions. We've got, TouchWorks in the enterprise ambulatory space. We've got Sunrise in the, mid-size hospital space, and also internationally. And then we've got, solutions for rural community hospitals. And what I'll say, is something that I think is quite unique about Altera is that we have this emerging technology that we call our care intelligence platform. And the focus of that platform is really on enabling what I describe as the foundational elements of artificial intelligence. So that's the data quality, the data sort of reliability, and the ability to sort of trace back data to understand where it originated from. As you sort of ingest this multitude of different sources, there's data that is, more trustworthy, right? EHR native data, for example, versus community data, versus perhaps patient source data coming from biometrics, from wearables, et cetera. And so understanding what, and stratifying the data from that regard to sort of assist in decision making or analysis, and deciding if you've got something that's a little bit more sensitive, that you're only willing to accept and ingest data of a certain caliber, right? A certain level of trust. And then beyond that, really the way I think of this platform is it's not about sort of AI as a product, but really governance as a product, and enabling that, again, like I said, the reliability, the trustworthiness, establishing the guardrails, and like you said, really being able to sort of tailor this solution to the needs of different stakeholders to align with their, like you said, their workflows, right? There's so many different users and different stakeholders within the healthcare ecosystem, and you're really, in my experience, there's so much inertia around a given workflow that if you try to disrupt that or try to inject AI and say we're going to totally change how you work, it's just no one will adopt it, no one will take it. So I think that sort of fluidity is really important, and that solution is one that we are generally working with large payers on in the U.S. space and on the international space. But we have some big health systems that we're engaged with as well, and so I'm really excited to see that over time sort of evolve to where we're seeing more enablement of agentic AI in the point of care, in workflow, partnered closely with the EHRs. And because we have this portfolio of health records, of rev cycle systems, as well as this sort of very different type of technology, I think that puts us in a very interesting position to sort of bring together different stakeholders, and especially bring together the payer perspective with the provider perspective, with the health system perspective, where I find that historically that's a real point of friction. And that's something that I think there's a lot of opportunity to overcome, especially as we get into, more and more embracing of accountable care.
Yeah, no, I appreciate you talking about kind of the foundation you have to put in place in order to support whatever your AI initiatives are. And, people, I think, like to sometimes skip those steps because they're the boring steps. They're often the hardest steps to put in place. And it's so easy just to there's just so much hype these days around AI and so much money from venture capitalists, with all these startups, that foundation is key. And in order that you have a successful and trustworthy product. So I appreciate you speaking about that and about governance. And I assume as part of your initiatives, you're also looking at agentic AI to support your workflows and kind of start to layer in some automation and move towards more of those like exception-based kind of workflows. Talk a little bit, I guess, even the importance of governance and observability when you're moving into that more autonomous space and kind of your thoughts there.
Yeah. So talk about the geeky subjects that, this is, I'd say, definitely an area that, isn't the most exciting, but I think arguably the most important, right? Mm-hmm. So from an agent perspective, I think one of the first foundational things to sort of consider is how you authorize that agent, what it gets access to, right? And so something that I believe firmly in is essentially the word impersonation sounds, a little scary, but it's sort of, in inheriting the authorization of the user. And so that way you've got, because we already have all of these really robust systems around access controls and authentication to say, this user has access to these patients, has this sort of, scope of responsibility. And so that's something that's already infrastructure that you can sort of tether an agent to and say, well, essentially this agent just inherits that from a tool perspective, et cetera. And then I think what's really critical from a governance perspective is establishing, like you said, those sort of boundaries, those edge cases. What, for example, you've got a high acuity scenario. Well, then, you really probably want to really limit the amount of autonomy that an agent has. Whereas I sort of see what I define as a risk spectrum, right? So there's lots of work that is highly administrative, that's perhaps, just helping a patient maybe navigate the hospital, figure out parking, there's a lot of administrative elements that are very low risk where you can have a higher level of autonomy. And so I think that a critical element of governance is essentially establishing those policies so that technologists can then go and define hard deterministic controls that essentially define those boundaries of, here's what is acceptable for an agent to execute on autonomously versus here's where we actually, need intervention. And then to that point of intervention, I think that transparency and observability is absolutely foundational. So when we look from a health record design, from that perspective, anytime we are surfacing AI-based capabilities as a first principle in our design, we want to make sure that the AI is always explaining and referencing, providing citations. And this is where another important element of governance is enabling the health system in the scenario of a health system to curate the reference material, the corpus that an agent would consume and refer to. So we partner with our health systems to define and curate, what medical education they want to reference, what best practice clinical sort of guidelines they want to reference, so that those agents aren't, simply referring to the world at large and their native training, but rather they are grounding in these sort of curated documents that we can then cite. And then make that very easy for a clinician to sort of follow, so they're not having to sort of guess or there's this black box that they don't know how it's arrived at some recommendation or some conclusion. And right there, you can sort of click and see, okay, well, here's the best practice, here's the clinical guidance, here's the education that is being referenced by the agent.
I think that's critical because there's tremendous opportunity when you think about agentic AI in the healthcare space, just by how much, particularly either administrative waste or then how we safely layer it into being, more patient and care facing. But it's going to be key in order for whether it's the physician using it or a nurse or whoever the end user is, for that trust and then also that awareness that there's guardrails in play. So very, it's kind of how we try to think about things as well, so that we're kind of ahead versus in this kind of catch up phase of putting those guardrails and then it might end up in a scenario where you're on the front page of the news that you don't want to be in. But I do think that trust piece is key, particularly working with, I'll come from the physician lens. We tend to be a little skeptical at times. We don't like our cheese to be moved, and making sure you're able to get the trust of the end user is key, and really appreciate the work that you're doing in that space. Now, you'd mentioned ambient AI a little earlier. So you have ambient AI rolled out, and is that well received from the end users? I know some of the studies are kind of mixed on like if you're actually getting as much time back, but I know there's been a lot of positive stories that I've heard in that space.
Yeah. So we have several integrated ambient AI solutions across our health records, and I'd say that it's interesting, to the point of when you look at rationalizing, purchasing, right, some new technology. I think that generally financial return on investment is going to be this sort of first thing that many healthcare executives need to look to, right? Because it's not cheap, running a hospital, and so that's always very much front of mind. And it's interesting where ambient, the financial impact is sort of downstream, and it's often not like an easy correlation, where the financial impact comes from things that are sort of leading indicators, right? Like physician satisfaction, sort of reducing burnout, which is something for years we've been talking about, is this really massive issue in the industry. And I think that we've made tremendous strides in that regard. I think ambient listening has really, for many specialties, right? For some, I think it's harder than others, but for many, it's made a real dent in that, helping providers to get home and spend more time with their families and to really, connect with their patients in a more meaningful way. The way I like to phrase it is, it enables clinicians to be focused more on being healers of people rather than administrators of care. And so I think that's been really a resounding success. It's definitely making people happier. It's downstream from that, you're starting to see as a slightly lagging indicator, right? So initially we're seeing improved clinician satisfaction scores, which I think leads into better retention rates, and then also improved patient satisfaction scores, which leads again to greater patient retention, greater referenceability. And so all of those things, I think, downstream have financial implications, right? So retention is like provider turnover is quite expensive, and then patient retention also drives better revenues for a health system. But in my conversation with healthcare executives, the financial is always sort of what everyone's thinking about and looking at. I think it's going to be even more top of mind, with what's happening with Medicare. And so it's interesting because ambient, one thing that we talk about with our, providers and our clinicians is that one potential outcome is, well, if you can spend less time in the part of our product is we also have sort of pre-visit summarization and sort of, a quick sort of what do you need to know type of stuff. And so that allows you to save time on the front end, and then you're saving time on the back end with documentation. So in theory, you might be able to see more patients, but generally the feedback from the clinical leadership is, we don't really want to, that's not the right sell. We don't want to say, yeah, see more patients. No one wants to like take on a whole lot more patients. So that direct sort of correlation to financial returns is more indirect. But I'd say as far as it at least reducing burnout and making people's lives better and allowing people to connect, it's a big success.
Yeah, no, and I agree. And, obviously coming from the vendor perspective as well, whenever we're introducing things, there's, you always have to prove the ROI and, in order to bring it in. But I do think it's interesting what you touched on with, and, it's not unique to physicians, it's nurses as well. But there is a high degree of burnout. There's less of the younger physicians coming into practice. They're looking for other opportunities because they're just worried about the quality of life. And so it is in that space, even if you're not getting a hard dollar return, you are like setting yourselves up for a more successful future by considering, if I continue to burn out my docs, I'm going to have no docs to take care of the patients. And I do appreciate you, because I've heard that from other physicians saying, well, now all they're going to do is make me see more patients. And then you've not solved the problem. You've just kind of created turned a physician into a cog in a wheel. And so I do appreciate that, because I do think that's an important thing. This is not about necessarily increasing the number. It's more about making sure you're effectively taking care of those patients and have the right tools in place to do it, so that you get the quality outcomes on the back end. I'm curious, because I think you've spoken about this before, because I think it ties in nicely, is the whole thing. And and I know I think it was even recently, there was some of the nursing organizations have kind of raised the flag again around concerns about AI taking jobs, and then concerns as being rolled out too quickly. But I know a lot of people, particularly as now, we're more there's more around agentic AI, and I think people are even a little bit more concerned about their job safety. How do you kind of approach that from a clinician standpoint in particular?
Yeah, so it's interesting where I think that I don't want to say that those fears are completely unfounded. I think that would be disingenuous. But in my perspective and experience, having managed many businesses at this point, generally, people's jobs, right? People when people lose their jobs, lose their employment, it's oftentimes a function of a financial issue, right? So it's often, and it's unfortunate that, many health systems are financially strained. The margins are really tight. And so, to the point of, just as we were talking, about ambient, and you don't want to just see more patients, but if you see more patients, right, that alleviates some financial pressure potentially. But another interesting sort of byproduct of ambient technologies is that we're seeing better documentation of medical necessity, and better documentation of a more comprehensive picture of the patient, especially when we consider now the ability to ingest more community data and then use AI to review that, reconcile it against the EHR's data, and then potentially find those gaps in care or those scenarios where we're maybe not fully representing the risk profile of a patient. And that has implications for reimbursement. So there is greater potential to capture more, complete reimbursement for a patient and better document the medical necessities. So thereby sort of reducing the incidence of denials and sort of easing some of those cash flow burdens. And so I think that when I talk to people about this fear of job loss and the fear of displacement related to AI, one of the first things I talk about is, well, look for real business problems and look for opportunities to use AI to help the financial performance of the organization, because that alleviates this pressure that is likely to drive decisions around employment. And then for individuals, again, to when we first started talking, one of the things that I really anchor in is this continuous learning and adaptation, and it's sort of, get comfortable being uncomfortable, get comfortable sort of being ready to adapt and try to partner up with really, smart, nerdy people and learn from them on a regular cadence, because I think it's interesting because you may not immediately find, a way to use AI in your work. You may not immediately see results, but over time, as you learn from these different people and you play with these tools and learn from them, you'll sort of find these connections just sort of, snap into place, and that creates these breakthroughs. But it's over a very long time horizon that happens. But that's my guidance to individuals, is just, try to use the tools in whatever capacity you can. It may be in your personal life because of, as we said, the risk, the guardrails, the governance challenges that exist when you're at that point of care. But talk to different parts of the organization and look for ways to get involved, because I think we are going to see a real transformation of people's responsibilities and roles being redefined. And that doesn't need to necessarily mean that people are displaced and lose their jobs, but they may, lose the role that they do today as it becomes redefined. I think that especially the sort of the more administrative functions will be the first to sort of see that role transformation. And so, but I think those are the spaces where there is the most opportunity for more rapidly exploring the tooling and thereby sort of securing your personal future.
Yeah, no, I agree, and I think it's a lot of people are afraid of it because they've never used it, and your greatest skill is that like we've touched on a couple of times, continuous learning, and how do you I mean, I think there's good ways to do it. Like just get your own, whether you want to use Chat GPT or Claude or, Gemini. Like I used, recently went to Iceland and I had it plan my entire trip for me. Like it's easy, you can get going pretty easy. Like it's just like use it, become less afraid of it and understand its strengths and limitations. I would like to ask, because I know a lot of people think about this is, and I'm sure you're constantly, have some initiatives around AI and you prototype them. And then, if it kind of, checks all the boxes and looks good, and you're going to move it into kind of more of a production and scale type. How do you think about that? Because it's hard. It's hard to go from prototype. It looks great in kind of a nice little well-defined world, and then you get it out in the wild and try to figure out how to scale. Like, that's hard. What kind of recommendations would you give folks out there?
So I think, it goes back to one of these first principles of starting with a real problem that the organization has, and then early on establishing what are the things that we're going to measure to sort of define success against this problem. How are we going to move the needle? And I think it is important to design sort of early pilots very intentionally, right? Identifying those champions who are forward leaning, but who also have a degree of influence, and then socializing those stories really consistently early on. So, for example, we found that in general, it's really peer-to-peer that users will start to develop that trust and get that confidence. If I see a colleague who's, going home at 5 p.m. and says that, it's actually pretty good, but here's where maybe the pitfalls are, here's where it works, here's where it doesn't, then you can start to build that sort of institutional trust over time. It really starts with, people trust other people and that they can talk to, that they can, rather than like a marketing message or something. And so, but then beyond that, or as really as part of that, I think collecting the data so that those more organizational stakeholders can see, okay, here is, a defined measurable return or a measurable progress that will sort of grease the financial cogs, right, to allow for more scaling. So there's the user side, the people side, which I think is peer-to-peer sort of championing, storytelling, and results. And then there is the organizational side, which I think is measurable results, sort of defining ROI. And like I said, with Ambient, you've got some of these sort of leading indicators that have downstream financial impact. And so drawing those connections, I think, goes a long way.
Yeah. And we just have a couple of minutes left. So I would love to ask you one more question, because I don't get the chance to be on the phone with someone with a CPA controller background. So token economics, there's a lot of talk around that. I think Uber, mentioned they ran through their entire budget for this year in the first 3 months. We're in the middle of kind of some long range planning and trying to figure out, as we layer in agentic workflows, like what is that going to look like from a budgeting standpoint? And it's challenging because you can't just Google it and a nice little article pops up for you. So I'm curious your thoughts on what you need to think about so you don't end up upside down when you're building something.
So first, I'll give one hot take from some personal experience at work, in that the hyperscaler vendors are great partners, and they're absolutely willing to help you build these solutions, and they've been wonderful to us. But they will be happy to help you build a Lamborghini and then, drive it off into the sunset and spend a fortune on gas, because they're the ones selling you the gas, right? So I think that's a word of caution, right? Is that depending on which sort of group you're engaging with for help, they may lead you down the path of building something really cool and exciting that ends up being really expensive. And so as organizational leaders, you've got to have that stewardship angle. And I recommend really deeply researching and sort of, understanding the unit of work and what the economics look like around the unit of work, because then you can model and sort of extrapolate from that foundation. And also in tandem with that, there's a lot of ways to make that unit of work more affordable, more economic. There's a lot of things that software can do that you don't need AI for. And so there's ways to really create deterministic elements of the architecture that drives down that overall spend. But that's I think the first thing is really understanding the unit of work. And then when it comes to agentic, because tool calls sort of also spend tokens and it can really spin out quickly, I think it's important to have those guardrails around, number of tool calls, limiting the scope of tool calling, et cetera. And I think from the vendor perspective, it's important to align to that unit of of work from a pricing standpoint, unless you've got a very strong economic model and a high degree of confidence that you've built out and earned over time.
Yeah, and I love that you said because right now everyone thinks every problem should be solved with agentic AI, and yes, you need to start with your problem, because if you don't have a problem, then you're just building for the sake of building. But you start with your problem, and then you may or may not need AI to solve it. So I appreciate you saying that, because I do think there's a lot of misconception that everything should be solved with agentic AI. Thank you so much for joining me today, Ben. You can stay in touch by connecting with Ben on LinkedIn. That's Ben Scharfe, SCHARFE CPA. Follow his work with Altera on LinkedIn, or go directly to their website to learn more at Altera, ALTERA health.com. You can find all of this information in our show notes. Thank you to our listeners for joining us today. Until next time, I'm Dr. Heather Bassett, and this is AI Amplified.
Thanks for listening to AI Amplified. Tune in to the Healthcare Now Radio Podcast Network for more episodes like the one you heard today. To learn more about Exelis, visit our website at exelis.com. That's XSOLIS.com. You can also follow Exelis on LinkedIn, Facebook, and X. Dr. Bassett would love to connect with you. Join the dialogue on her LinkedIn, where you'll find her at Heather Bassett, MD. Let's keep the conversation going.